Hi, I'm Dr. Nanda Rajaneesh, surgeon from Apollo Spectra and Sakra World Hospital. Wound healing is my topic today. Wound healing is important for all the surgeons. Fat is our wound enemy. So, obesity, the wound cuts, healing is prevented. Let us start with what are the different phases of wound healing. So, there is an inflammatory phase. In the inflammatory phase, hemostasis happens, fibroblast migrate, and there is the granulation tissue phase and the healing phase. In these three phases, different things happen. Hemostasis is very important to the wound. Giving rest to that area is very important. Movement of the wound, like for example, there is a cut on the hand where you keep folding the hand, the wound doesn't heal there. So you have to rest. That's why we put plaster or some kind of this thing, some kind of strand to prevent movement of the hand when there is a wound there. But anal wounds that I operate, I cannot rest that area. That's the reason. And bleeding is also common in that area because it's highly vascular area. And thirdly, fecal matter keeps falling, and you cannot rest. So because of this, wound healing takes longer time. Whereas abdominal wounds heal very fast, breast wounds heal even faster, facial wounds heal even faster because circulation is very high in face. There are complex blood vessels, tiny blood vessels allow the wound healing on the face faster. So why we should know wound healing? We all keep going for minor surgeries or we get injured. Like animals get injured all the time in the forest, but they heal by themselves. And us, we should know when we have a particular wound or when we are undergoing surgery in particular area, how many days the wound takes to heal. Normally wound healing is 1 week, but complete scar formation can be up to 6 weeks. Complete scar formation with scar redevelopment, complete redevelopment of the scar is 6 months. That is hypertrophic scar formation, keloid formation. If you want to know, up to 6 weeks you have to watch whether it is just a hypertrophic scar or a keloid, because if it is hypertrophic scar, by 6 months it flattens and you should not panic. So and there are different ointments, treatments for wound healing. I normally don't advise unless there is infection. We culture and we give antibiotics. Cleaning the wound with simple saline is enough for the wound to heal, because too much of foreign bodies if you put on the wound, it may not heal. That is why I always give, sometimes I give oxygen spray. Increased oxygen prevents the anaerobic infection in anal wounds that I follow. So other than that, I normally don't use too much of ointments and serums or betadines, and simple saline spray helps in wound healing a lot. Thank you.